Hello, everyone. Welcome, and thank you for tuning in today. I'm Albert Chu, Executive Director of Health Analytics at Blue Cross Blue Shield Association, and I'll be moderating today's discussion. I'd also like to welcome my fellow panelists, whom I'll introduce in just a moment, and thank them in advance for joining in this critical discussion about the health equity crisis in America and its impact on the workplace and workforces across the country. Advancing health equity will take all of us. The pandemic, a wide range of cultural shifts, and the transition to the next normal that we're all living through right now are certainly affecting the issue, to say the least. But what's really important is moving from talk to action. So in our discussion today, we'll highlight perspectives about what stakeholders in healthcare must do. We'll provide strategies employers can take and are taking to make an impact. And we'll show how we can move beyond just our own individual roles to the level of coordination and collaboration needed to support, amplify, and take action on what we can do together and differently. We just released the first in a health equity series of mini e-magazines, which you can download a copy of the mini e-magazine and other helpful resources in the resources to download section of this webinar. We'll also have time for Q&A at the end of our discussion today, so if you have any questions along the way, please put them into the chat function, and we'll cover what we can in that portion of the program later on. But without further ado, it's my great pleasure to introduce my partners in today's discussion. First, Dr. Adam Meyers is Senior Vice President and Chief Clinical Transformation Officer for the Blue Cross Blue Shield Association. Dr. Meyers drives clinical transformation across the Blue Cross Blue Shield system through national networks, quality initiatives, and policy and advocacy positions. In his role, he collaborates with the chief medical officers across all of our 35 Blue Cross Blue Shield companies and leads the Office of Clinical Affairs and the Blue Cross Blue Shield Institute. A longtime advocate for community health and health equity, Dr. Meyers helps set the vision for the Blues' efforts to create a more equitable healthcare system. Next, we also have Bridgette Hurrell, who is Vice President of Inclusion and Diversity and Chief Diversity Officer at Blue Cross Blue Shield of Michigan. She also leads the Office of Health and Health Disparities, focused on achieving health equity in care delivery and access. And she manages the Diversity Leadership Council, driving cultural competency learning opportunities for employees. In 2020, Bridgette was appointed by Governor Gretchen Whitmer to the Michigan Coronavirus Task Force on Racial Disparities and was given the DentaQuest Healthcare Heroes Award for addressing health equity in the age of COVID-19. And finally, Amanda Smith, Chief Engagement Officer at Morgan, Lewis & Bockius, one of the 10 largest law firms around the globe. With thousands of people in offices worldwide, as part of her role, she's been instrumental in developing and leading the organization's diversity, equity, and inclusion and well-being programs. Some of you may have seen Amanda join us in a previous webinar we hosted on behavioral health and its impact on workforces. And so it goes without saying that we're thrilled to have her back. Adam, Bridgette, Amanda, good afternoon to you, and good to have you. Thanks for joining and lending your perspective as part of today's panel discussion on health equity.
Great.
Now, before we dive in, for all of us, and for those of you in the audience, I'd like to provide some quick grounding to help frame today's discussion. To start off, health equity is a term that's being used more frequently and is becoming more common in our broader social and professional conversations, and it can certainly mean different things to different people. So we want to be clear about how we're defining health equity for the purposes of this discussion today. This is the World Health Organization's definition and the one we've committed to in our health equity efforts. Health equity is the absence of unfair, avoidable, or remediable differences in health among population groups defined socially, economically, demographically, or geographically, or by other dimensions of inequality. We also refer to gaps in health equity as health disparities. We'll talk about many of those disparities today, highlighting the scale of their impact on people's health and well-being, as well as on organizations. So let's go ahead and jump in and start with a look at health disparities related to key conditions employees are facing. And here you can see right off the bat, our research here shows that regarding maternal health, maternal mortality is 3 times higher and morbidity 2 times higher for Black mothers than for white mothers. When we look at behavioral health, and this is likely due to underdiagnosis from what we've seen, millennials from majority Black and Hispanic communities have lower diagnosis rates of depression, 31% and 55% lower respectively when compared to white communities. Studies show Black adults are 60% more likely than non-Hispanic white adults to be diagnosed with diabetes. And in terms of cardiovascular health, our evidence highlights that Black men are 70% more likely to die from a stroke as compared to non-Hispanic white men. Of course, it goes without saying that we should also acknowledge COVID-19, given what continues to be top of mind right now for all of us, and the part that it's played in exacerbating disparities across all of these conditions and others as well. So I'd love to open things up here for a moment for some initial perspective from our panelists. Bridgette, I'd like to start with you here, and then would also love to hear from Adam as well for some initial thoughts. But where are you seeing the impact of these disparities play out most prominently from your view?
Sure. First, I'd just like to start off by saying thank you for this opportunity. I have worked in healthcare for more than 25 years in various capacities. And it's just so exciting to see the opportunity for all of the players in our community, our healthcare ecosystem, the business, to really come together around this discussion on health equity. And I really love the definition that you shared around health equity. It really underscores the importance of us being able to, one, pay attention. And then after we're paying attention, listen to what real employee needs are in this instance. And then take the steps to remove the barriers that get in the way of that ideal of optimal health. And so when I think about where we're seeing some of the disparities, we know they're many and plentiful. And we're seeing them in terms of being able to establish trust. And I wanted to lead with trust because it becomes a true barrier in how people access healthcare and the confidence that they put in it. And when we have the disparities and African Americans, Latino community members see themselves always, at risk, it kind of limits the trust in the healthcare system. So that's one way that it plays out. Another way, of course, is when we think about wellness, that ideal of maintaining good health on an ongoing and regular basis, and the thought of well-being, that state of being healthy and being happy and comfortable. There's their opportunity to address that as well. So when we think about the workplace, we can focus on that ideal of absenteeism. And when we're not well, we're not going to be at work and contributing to the workplace. And when we're not well, our productivity levels go down, whether we're dealing with our mental health concerns or we're dealing with managing our diabetes, for example. Also, when I think about where it shows up in our ability to really understand it and wrap our arms around addressing the drivers of healthcare, those things we call social determinants of health, and the ability to truly understand how they play out as a whole among our employee population, but then also person by person, because there's so many variables and factors that come into play. And then also I will end by focusing on COVID-19 and these last 2 years. And then, when I say that, I can't believe that I've been sitting in my home office for 2 years. And when we reflect on that, and we think about the disparity that came with COVID, the coronavirus and COVID-19, and that disparity was seeing the number of the morbidity the number of cases and who they were afflicting mostly, and then also the mortality associated with that, who was dying. And here in Michigan, for instance, we know that in the early months of the pandemic, we were seeing disparities of African Americans being 4 times more likely to die from COVID. And through our education and outreach efforts, we were able to bring that disparity down by, again, providing accurate, reliable information and bringing community partners together, as well as the employer capacity as well.
Gotcha.
Thank you so much. I'll just weigh in here too. I'll say that as stark as these numbers are, I am grateful for the conversation today because unfortunately these data are not new. These realities have been in play for hundreds of years in the United States, and really, as my colleague said, arise from a lot of things that are not directly related to healthcare. She alluded to the social determinants of health, and the public health literature really shows that these social determinants of health, things like access to education, access to transportation, access to healthy food, access to a safe living environment, access to financial solvency, those social things such as that really lead to about 80% of people's health outcomes. And 20% of people's health outcomes are more directly linked to traditional health care and access as we would normally define it. So given that, it's very clear that in order to impact this takes a change in not just our health system, but in our society in order to be able to address the structural racism and other factors that have contributed to these social determinants of health and the disparities, because they're directly what links to the outcomes that we described. One clear representation of a social determinant that I like to describe is that of lead poisoning. It's I know you've suffered with that a bit in Michigan, and lead poisoning is at its core not a health issue. It is a housing and water supply issue that reveals itself with a tragic health outcome. So that's a very clear example of a social situation, a societal infrastructure problem that reveals itself in a health outcome that is tragic and frankly unreversible. And so that should, I think, clearly delineate what we mean by a social determinants of health. And again, it's not just for along racial lines. The social determinants of health are major influencers in a lot of different areas. Take cancer, for example, where the CDC recently showed that death rates were 14 times higher in rural areas than in urban communities. And in urban communities, they're higher than they are in suburban communities. So it's we have a serious problem. And why is this important from an employer standpoint? Well, guess what? These are American lives that we're talking about that are affected here, and they also happen to be your workforce. So it's the health of our workforce is key to the productivity of our efforts and the health and well-being of our teams, and addressing these things, becoming informed in these areas is critical for all of us as we move forward and try to improve the outcomes.
Yeah, I agree on so many levels, and really critical, especially as you mentioned, Adam and Bridgette, you as well, just the impact of social determinants and how critical that is to keep in mind. And that's certainly something that we see front and center as well in our ongoing work at analytics here at the association as we continue to study issues and identify where we're seeing health disparities and deep impacts that these social and environmental factors can really have at a community level for our members. So, there's a lot to think about here on the healthcare side and in terms of what different employee populations are dealing with. But would love to also shift gears and also tee this up for you, Amanda. Let's now take a look at how this is hitting the workplace and how employers are taking notice and looking for strategies to address health equity. And of course, Amanda too, would love to get your perspective on how you're seeing a lot of this front and center play out the most, and disparities play out the most prominently from your view as well. But here we have a few data points from SHRM, the Society for Human Resource Management, recently, which studied racial inequity in the workplace over a 5-year period, and found that turnover caused by racial inequity at work may have cost employers up to $172 billion over that time, and that absenteeism caused by experiencing or witnessing racial bias and discrimination at work may account for up to $54 billion in loss. And studies have also estimated the cost of health disparities resulting in about $93 billion in excess medical costs, which employers may be carrying the brunt of. And lastly here, $42 billion in lost productivity. So Amanda, any reactions to this? I mean, on the one hand, there's a tremendous amount of money that's being lost here, according to what the data is telling us, and productivity is mentioned here as well. I'd love to hear your thoughts and hear, you talk about the higher level impact or result that this can have and what you've been seeing on a workforce in your business. Sure.
Yeah, it's these numbers are really staggering, aren't they? They can be very intimidating, and I think that as employers, you sort of look at these very structural issues. I could not agree more with Dr. Meyers, who said that, we're dealing with systemic societal issues as much as we are anything else. And so as employers, I think it can be intimidating and challenging to try to think about what our place is. How can we productively influence this conversation when you look at this massive problem? And it is a complex issue. And I also completely endorse what was said earlier about how what we're seeing is not new. We're seeing pre-existing trends that are just accelerated by sometimes the pandemic. And so I do think that sometimes it seems insurmountable. We're trying very, very hard. And I actually think, to sound a note of optimism, I think many employers are trying very, very hard to look at these issues squarely. And I'm not so sure I'm willing to say that it's a silver lining to COVID yet. I'm not sure that we can really talk about COVID with a silver lining, but I think it has pushed employers to try to confront these overlapping issues. So what do we do? What do we do as employers? I'll just offer a couple of things that I think can be food for thought for those who are listening, or maybe for us to discuss as a panel. So first, I think we need to stop thinking about well-being and DEI as programs or as initiatives or as siloed parts of our business. I think that we have to, certainly we're trying at our firm, and we have to more generally as employers, think about well-being and inclusion and belonging as central core management principles that we bring to every part of our organization, and try to see our relationship with our employees through the lens of those two concepts. So I would really encourage anyone listening to noodle on that, because I think that's a powerful idea when you stop thinking about these things as siloed programs and start thinking about them as values, organizational values that need to pervade everything. The second thing I wanted to, let me give an example of that, because it occurs to me that that might be kind of nebulous. So we just rolled out a very, very comprehensive unconscious bias training. And I think our time is too short to get too much into what that is. And so I would encourage anyone to Google that if you're listening and wonder. But I think we need to think about things like unconscious bias training as well-being programs. That is the trying to productively influence the relationships that we have with each other between managers and those who are managed, and within this web of relationships that we have within each of our organizations. I think I think that that can be a really helpful view. Okay, so now that I've given that example, the second thing I wanted to mention, and Bridgette alluded to this, is that I think we have to stop thinking about this as a problem that has one solution. There is no one-size-fits-all solution to these overlapping problems and overlapping issues that present themselves, right, as health disparities, as a lack of health equity. So I think for us, at least, we need to try to innovate and educate and try many, many different kinds of approaches to address and seek to remediate this really complex problem. So I think I would want to amplify what Bridgette said about going out and listening to your employees. Not every sector of your employee population is going to have the same issues or experience health disparities in the same way. And so going out and listening and trying to connect very directly, whether it's through your employee resource groups, whether it's through stay interviews, whether it's anything that I think we can do as employers to draw that information from our stakeholders, our employees in particular, is going to help us in fashioning remedies that are really specific to the underlying problem. So an example, when we saw the sort of dual crises of both COVID, but also the aftermath of the murder of George Floyd and Breonna Taylor and so many others, we felt like we had to address that very specifically, the fact that the linkages between those two things. And so we brought in an expert on Black mental health in particular to provide some supportive resources for our employees who are Black. And I think that level of specificity and detail is often going to be necessary in order to correctly identify in a sort of non-paternalistic way the real needs. And that's the first step to trying to address them.
Well, that's fantastic. It's interesting to hear you talk about the challenges and also the drive to address this and what you've just articulated. I really like what you said about the need, especially to think broader and think more holistically around how we think about health equity, how we think about diversity, equity, inclusion, and wellness more broadly, and make them and embed them as core management principles in our work. I think that's just so well said. To build a bit on your points, we also recently conducted research with business leaders, and one of them I felt put it really well in painting the scale and the gravity of the challenge that we're up against. So I wanted to just highlight this quote here, waiting for the platform to transition. But this leader said, first of all, it's the right thing to do. Second, the issue is so ingrained in all levels of healthcare that it's probably too big of an issue for any employer to tackle by themselves. Amanda, turning to you again here just for a second, this seems to line up well with what you just articulated. Any reactions to this idea of the issue being too big for employers to take on alone?
Yeah, I mean, I would absolutely agree with both of the points that this person has stated here, and I hope this person is listening so that he or she can hear that. It's clearly the right thing to do. I mean, I don't think that we can really have any kind of pushback on that, right? This is just basic fairness. And secondly, that's right. I think these are societal issues and they require a societal response. That doesn't mean that we can't work on it. That doesn't mean that we can't try to build bridges. We work a lot with our clients. We're a huge law firm, and our clients are essentially the Fortune 100. And what I see at my firm is mirrored in what we see at our clients. A sense of caring and an enhanced sense of wanting to take care, and we can work together. We can work with professional organizations. In my field, we can work with bar associations. I suspect that there's many who are listening who have a fairly significant supply chain. You can engage with those companies that are within your supply chain to start to try to look at and address these issues. So I do agree that it's too big for any employer to tackle by themselves, but I don't think that we should use that as a reason not to start. Step one.
Yeah, I couldn't agree more. And Adam, I'd like to turn to you here as well and ask for your thoughts. And how you think health plan partners can support employers and where those partners have to lead.
Yeah, I think there's a lot of ways that we can support, and one of them is the call for new and better data. It is only recently, and we still have a long ways to go, that racial, ethnicity, and language data are gathered with any sort of consistency in the medical record. So if they're not gathered in the medical record, how can you explore and study them as factors that potentially contributory? The same goes for social determinants of health data. Only recently, I would say in the last 2 years or so, have health systems begun to figure out how can we reliably collect these data as well. Do people who are entrusting us with their care have the food that they need? Do they have safe and affordable housing? Are they in a safe environment free from domestic abuse or violence? Do they have reading difficulties? Do they have all kinds of struggles that are very real and very impactful for people's health outcomes? That those were just simply data that weren't captured before, and only now are people beginning to capture them, and then importantly, factor them into treatment plans with an eye toward mitigating those social struggles in addition to just treating the quote-unquote traditional disease state. So I think part of that is partnering on those data and encouraging employees and our staff to be forthcoming about self-reporting on those things to their healthcare providers is, I think, important. And again, that's a difficult thing, and there's trust barriers that exist that are very real and frankly quite earned in the healthcare system that we have to overcome. But I think only as we get these data can we lean in quite a bit. There's a lot that we can do, and we have a national health equity strategy that we'll touch on in greater detail later. But part of that has to do with focusing on impacting maternal health and doing so by sharing this implicit bias training for providers. We partnered with the March of Dimes and made implicit bias training, their implicit bias training, which is wonderful, available to 1.7 million credentialed clinicians across the Blue system, that they can take this free of charge. We're going to be leaning in on diabetes and cardiovascular conditions, as well as the important stigma and struggles that people have with behavioral health. One of the data points that you shared early on, Albert, was that people who are in minority communities suffer unnecessarily and in a disparate way from undiagnosed and untreated behavioral health struggles. That's a crime. And we are only when we are looking at these data and working together to impact them can we do that. And part of it's going to be data, as I've described. Some of it's going to be scaling best practices and programs that have worked. I've talked about unconscious bias, but also activating new and creative public, private, payer, provider, community partnerships at a local level. This is a national problem that will get solved at both the national level and the local level. And it can seem overwhelming to think about it, given all of the different factors involved. But I like to say that we cannot do this alone, but we each alone can do our part. So if we each plug in and do our part, then in aggregate together, we'll move the needle.
Yeah, that's very well said, Adam, and appreciate you talking a little bit about some of the thinking and the action that's already underway across the Blues. It's certainly work and a topic that's been near and dear to my heart and so many of others at the association and across our Blue plans. So, with this in mind, I'll ask Bridgette here first, and then perhaps also some follow-up from you, Adam, just given what you just shared just now. But the question I have here is, what other ways do you see health plans and employers working together to advance health equity?
Yeah, so I want to go back to something that Amanda said that really fits into this. And I think when we look into our workplace community, we have the opportunity to bring humanity back. That means recognizing that each person who walks through that door, that they're a person, a human being, and being able to recognize what their unique needs are is key. And when we talk about diversity, equity, and inclusion, and I always say these are really big words, the opportunity there is to break that down and define that. Diversity is not just about race. It's really, again, about that opportunity to recognize the different dimensions of a person. So when we think about wellness and well-being and addressing health and healthcare disparities, and I always separate the two on purpose, and I'll define them in a minute, there's that opportunity to really be specific and personalize healthcare and healthcare delivery to a degree. And I always separate health and healthcare disparities because they're truly two different things. A health disparity refers to those outcomes that we see disproportionately towards a certain population in our community. And again, it's those health outcomes. When we think about diabetes, and we already saw the statistics around that, that's the health outcome. But when we think about healthcare disparities, it's that reflection on things like access and the coverage. And so as employers, we can think about the kind of coverage that we provide for our employees. And then another opportunity is around health literacy, where I see it as a great opportunity for people to come together, the plans and the employers, to really make sure that we're communicating in a way that's clear and simple, that we're communicating in a way that's culturally competent and is reflective of the individuals we're communicating to, that we're providing clear instruction and information on resources that are available in the community and how to access those resources. We've heard the saying, it takes a community or a village, right? It takes a village. And it's really true in this situation. There's no silver bullet. As I mentioned at the start of this, I've been working in healthcare in different roles for 25 years, and we're still trying to solve the same issues. What's exciting is that now we're really coming together and we're engaging in this dialogue. And as we engage in this dialogue, that's the opportunity for us to share the best practices. And I'm really excited about the work that we're doing in alignment with the Blue Cross Blue Shield Association around our health equity strategy. And we have 5 primary focus areas. We're focusing on primary care access, the quality of that healthcare that's delivered. And in 2020, we launched our unconscious bias education for primary care providers and the staff in their office. Because we have to think about when an individual walks into that doctor's office, what is their immediate experience? How are they received? Are they received in a culturally sensitive and appropriate way, for example? Do we take notice that they may be a member of our deaf and hard of hearing community? So all of these things are important to pay attention to and develop that self-awareness in the delivery of care. We're also focusing on behavioral health, maternal health, looking at chronic disease prevention in general, as well as health promotion. And a lot of that is through working with employers and working with community organizations to get, again, accurate and reliable information about the various health concerns and prevention of those health concerns. And when we talk about COVID, we did a lot with COVID. We did everything from addressing food security that increased over these last 2 years, even more than it was, to getting information about where you can go for testing, helping to get testing in local neighborhoods and communities so there's access. And then when it comes to the vaccine, the same issue, getting it to where people have access to the vaccine. So we're not seeing disparities in terms of who's getting the vaccine because there's no access and who's not. So those are just some of the ways that we have partnered with our employee community. And I must say that we worked with a group customer as well around addressing unconscious bias. We had dialogue. We were talking about what the needs are. And together we came to that conclusion that this is one area we need to strongly focus on. So again, I'm going to circle right back to the point that the more we have dialogue and the more we share best practices and we're listening and we're deepening our understanding, we're going to come up with solutions that can truly move the needle. And that just excites me so much as I look into the future. And I see a bright light. I'm an optimist, but I'm going to keep seeing this bright light. And, it's moments like this that really encourages me in the work that we're doing.
I love your optimism. I share the same sentiment, and I think you have to be to work in this industry and be a part of this change that I think we're really on the cusp of. Adam, any additional thoughts that you'd like to share here too?
Yeah, I think I'll echo many of the things that Bridgette shared, but I'll double click on one piece of it. She used the word prevention. Our health system and our approach to healthcare in the United States is really more one of disease care than it is of healthcare. It's treatment of disease rather than promotion of health. That's the way it historically has been in the U.S. It is not that way in all countries. And in fact, I think that is, if you study it, that is in part one of the reasons why our healthcare spend as an industrialized nation is number 1 out of the top 11 industrialized nations, and we are number 11 in outcomes amongst the top 11 industrialized nations. So number 1 in spend by far, number 11 in outcomes that matter in very basic, important things like life expectancy. So that's partly because of our focus on the downstream. And so to the degree that you as employers can partner with health plans and others about focusing on promoting health, promoting well-being, promoting prevention amongst your teams, then I think that will help change that paradigm quite a bit.
Yeah, I totally agree. And, thank you both, Bridgette, Adam, for sharing your thoughts here. And it's actually a good segue into our next section. So let's actually go into the topic of what's top of mind for employers a little deeper and, discuss what we see companies and their business leaders already doing. I'll just bring in this study here by the Business Group on Health, an association of benefit experts and large employer members. They looked at what companies were prioritizing in light of the impact of the pandemic and how they've potentially accelerated certain priorities as a response. And you can see here just right off the bat, improving mental health access and services, expanding virtual health services, and promoting health equity in terms of increased focus areas really rose to the top. So Amanda here, what are your thoughts to what seems to be rising to the top based on the insights from this BGH survey? Any reactions to this from your point of view?
So, yeah, I think this is entirely consistent with what we're seeing ourselves and also what we're seeing with our clients. The one thing I will say, though, is that while accurate, I'm not sure it completely tells the whole story. My very strong suspicion is that the first metric measured and the last are actually seeking to get at the same thing, right? That, there are disparities in mental health access and services that we know the science is very clear. So corporations who are promoting health equity will be seeking to improve access, mental health. We've been talking about access. Bridgette was talking about that as being one of the key things that employers, I think both of my fellow panelists were talking about those things as a very interesting way and productive way for employers to get involved in this conversation and work on this problem is to reduce barriers to access. And so I suspect that's happening here, is that as we're focusing on health equity, we're focusing on mental health access and vice versa.
Right, I agree with you, and I think just that more holistically, yes, I think is a better picture of what's going on here. And Bridgette, do you have any thoughts here from your perspective?
Yes, definitely. Two things came to mind just now, and it's reflecting on what you brought up earlier, Amanda, about the events of 2020, from the murder of George Floyd to the global response that we saw And since that time, just all of the national tragedies that we have experienced. So we can even equate this to all of that beyond COVID-19. So I kind of wanted to lift that up because we know that even though many of us are still working remotely, that we're bringing all of this into the workplace. So that call and that need to improve mental health services is key. But another piece is that as we think about that, I will add on in terms of that equity piece, that when we think about expanding virtual health services, making sure we ask the right questions about the ability of all employees to be able to access that and with ease and what that looks like. And then that opportunity to really understand when we're creating that access, you know, what do the practitioners look like? And Albert, I want to try to recall some of that recent information from the behavioral health data that you all just shared at the association about African Americans in particular. They feel most comfortable with a behavioral healthcare professional who looks like them. And we know that across this nation that there is a gap there, but it's also something we have to keep in mind, we have to consider when we think about these services. So it's one thing to provide the service, but it's another thing and a very important thing to make sure that we're providing the services in a way that meets the needs of employees.
Yeah, I couldn't agree more, and also appreciate you, teeing up our work that was pushed out recently. I want to pivot a bit here by, acknowledging that, we're talking a lot about access, which, certainly agree is absolutely critical. But to take this even further, and the question that's coming to mind for me that I think will help frame this next section of our discussion here is, what beyond improving access do employers need to focus on? One thing we've been mentioning along the way is education. From my view, I'd also pair that with training, right? One thing that I think would be important and impactful to our audience to talk a little bit more about then is, how this ties into, cultural competency. And Bridgette, I'll pick on you here again, but I'll mention, I mentioned your focus on cultural competency in your role as part of our introductions at the top of our hour. I want to read a quote of yours here that I found to be compelling and relevant to this topic. I read where you said, quote, "At Blue Cross Blue Shield of Michigan, we are on the path to cultural competency, a place where there is understanding and acceptance of differences as well as similarities." What I really like is that, you say you're on a path to cultural competency. What does it take to get to cultural competency?
Well, first of all, it's a lifelong process. I've worked in, again, healthcare, working with many communities, many different communities, and learning to understand what their needs are. And I've worked in inclusion and diversity for 6 strong years, but I'm still on a journey. I'm still on the path to developing cultural competency. And so I would start there with the fact that it's lifelong. And what it involves is the opportunity to remove ourselves from our normal circumstances. I live in Metro Detroit, and Metro Detroit is actually one of the most segregated communities in the nation. And I think it's going to be modeled in a lot of other communities. So we go to work, we interact, and we interface with others who may look different from us on the outside. But then we go back home to our communities where most of the people are going to look just like ourselves. And so that's the opportunity to remove ourselves and immerse ourselves in environments and communities that is not our norm, that looks different from what we're accustomed to. And that's when we're going to expand, I call our consciousness, that ability not to see something as different or foreign or, I'm uncomfortable with it, because that's where the unconscious bias comes into play. And as human beings, we all have it. So I always like to say that. But like when we're in the provider setting, for example, it can show up due to weight issues or views we might have about the LGBTQ plus community. Again, stereotypes and assumptions we may have about African American women. But the more that we expose ourselves and learn about those different communities, learn their differences, because there's richness there, but then also the similarities, it's going to be less of a foreign ideal or concept, where we're going to be more mindful in our interactions. And we're going to recognize that the person across from me is not someone so different from me, or I hold this stereotype for the person. The person across from me is a human being with their own unique needs in terms of healthcare. And we're going to focus on prevention, because we really got to move from that place of sick being the norm. Sick is not the norm. Wellness and well-being is the norm. So at Blue Cross Blue Shield, for example, and I'll wrap it up here, is that it is the cultural competency is the cornerstone of and the foundation of everything that we do around inclusion and diversity. It's required education for our employees. So as new hires come into the company, they have to go through this learning session, and we continue to build on that every year with over 100 learning sessions. We cover the spectrum from different cultures, communities, generations. That's important. If we think about everything from senior sensitivity to just recognizing, again, the similarities and differences in the generations, looking at different work styles and different perspectives. So all of those come into play when we're talking about the workplace community in general and learning about what their needs are, and also when we're talking specifically about how we deliver healthcare or how we develop healthcare policy. So that's important too. And so we have to be mindful of the bias, even when we're developing policy. As Dr. Meyers shared earlier, this is systemic. A lot of what we see is systemic, and we have to pay attention to the programs and processes and policies that we're putting in place that sometimes lead to these disparate outcomes.
Yeah, all excellent points, and I totally agree. Amanda and Adam, I'd also point a follow-up question here to you. Are there specific things that you think employers can do or steps they can take to promote a culturally competent workplace?
Yeah, I mean, absolutely. I'll jump in. I think the biggest thing that we can do right now is, I think Bridgette was alluding to this, is understand ourselves as employers, whether you're in HR, whether you're in the C-suite, whatever part of the organization that you're in, that you are in a process of continuously educating yourself about cultural competence, because culture itself is evolving, right? All of our norms are changing, and that's great. That's good. We're on, hopefully on that arc towards a more sort of equitable society. So I really do think that that education is important. And if you're in a position where you feel like your management could benefit from education, you have the ability to put some of these things in front of management, right? Those very intimidating numbers that we talked about earlier about how much these health disparities are a drag on productivity, how much they're costing employers. That's really good information to get in front of management in order to make the case that there is a role for employers working within this larger community to try to address some of these issues that we've been discussing.
Yeah, I would echo so much of what colleagues have said, and I'll stress a couple things. In fact, I'll issue a little bit of a challenge to employers, frankly, to all of us, would be to look internally at ourselves, at our own policies and procedures around a variety of different things. Our hiring policies and procedures, how we interview versus don't, our policies around tardiness to the workplace and things like that. I mean, if you have significant portions of your workforce that are dependent on public transportation that is implicitly less reliable maybe than transportation that is private, do you have some sort of grace involved that allows people who have that challenge to occasionally be tardy? Remote work opportunities. Not everyone has access to high quality broadband. The digital divide is real, and COVID made that even more clear when the digital divide to at-home work, at-home school, and at-home remote healthcare became very, very real and further created disparity. So are there ways that you internally, as you have remote workforce, can you promote accessibility to work through things like hotspots, et cetera? But then I would also, even basic things, I would challenge the teams to think about, even when you schedule your meetings, are you scheduling your meetings at those critical hours when families are transitioning with children and with loved ones, et cetera? And if so, and you're scheduling your critical meetings at those times, are you inadvertently excluding people who might be more female or might, have more responsibility for those family issues from the conversation? And so even on sort of a very granular level like that, I think there's opportunity for improvement. So that's where I'll pause.
Right. So as we can see from the perspectives our panelists have shared here, there's plenty for all of us to work on to address such a systemic problem. Just doing a quick time check here. Let's wrap this section of our discussion before we get to Q&A by summing up some of the specific strategies we've covered just briefly. And here are a few things that we've discussed where employers can start. Number one, collaborate with your health plan partner on practical ways to improve access, and crucially, consult with them on how to educate leadership about health equity to obtain the right level of buy-in and involvement at the top. Secondly, create flexibility when it comes to time off, PTO, work scheduling and leave, for health needs like vaccinations, preventive screenings, doctor visits, behavioral care, or consider bringing services on site. And finally, listen to diverse groups of people and meet with employee resource groups to better understand the needs and address barriers for employees across your workforce, just as Adam articulated just a few minutes ago. We talked about all kinds of things, from certain populations having trust issues with providers to uncovering internal policies or practices that may be negatively impacting certain groups. So, I'll go ahead and bring us to, since we have 7 minutes remaining, just open things up for Q&A. And I'd like to just start off here checking the Q&A panel here of our platform. We have a couple questions, but just to start off with here, and I'll feel free, anybody on our panel here to start, but what mechanisms have you found effective for soliciting employee input on this topic and the unique needs of specific employee populations?
I can jump in here. Sorry, go ahead, Bridgette.
Yeah. I think I was just going to build on that concept of the value of employee resource groups. We call them networks at Blue Cross Blue Shield of Michigan. And the opportunity to really use those groups of community to get some insight about what those issues are. You would be amazed at how there's such great feedback that comes back through those conversations and dialogues. We have one that's called Bright Blue Employee Resource Network that focuses on seen and unseen disabilities, and it provides a wealth of information. We have another equally blue that focuses on the LGBTQ plus community, and I really lean on them to kind of be my eyes and ears in terms of what we need to understand better about serving this community, especially as it relates to transgender needs, for example. So I think those have been very effective for us as a health plan, working in partnership with employers, for example.
Yep, I agree. I was gonna talk about ERGs too. But it's all about relationships, right? You have to sort of get in there and know and approach it, I think, with humility, right? With this concept that we're all continuously learning, and we might make mistakes, but we have to sort of embrace change and operate as if we're all on the same team, right? That we're all trying to sort of make it a better, more inclusive workplace, a workplace where people are thriving, not just existing in a place where they aren't sick. Instead, they're thriving. That's what we're pushing towards.
Gotcha. That totally makes sense. We do have a question that's come in from a friend of ours at Blue Cross Blue Shield of North Carolina. She asks, when large employers are promoting health equity, what exactly does that entail? And I'm sure there's a lot that comes to mind for both of you, Bridgette and Amanda, but feel free to jump in.
I'll let you go first this time, Amanda.
So I wish that there was a single sort of cookie cutter response to that. I think that there's a lot of different approaches that an employer could take, and many of them are going to be worth doing. And they may vary. What does your population look like? Do you have a population that happens to be mostly women, employee population? I mean, where are you geographically? Do you have, what do you know about your employee population that can help you pick a strategy, right? Are most of your employees over the age of 60? Are most of your employees, do they have children, young children? I think that there's a lot that you can do, because health equity issues, or health disparities rather, can have many different forms. So I think you start by educating yourself, right? Looking inward. I think, Adam, you said that, right? That you need to look inward at your own population, trying to learn about your own organization. And then there are enormous resources, including the amazing e-magazine that I just want to point out was just developed. I think that that's a great place to start, and you can sort of build from there in thinking about strategies. The only thing I would say is that I would not limit yourself to one strategy. Prepare to sort of try multiple things, have them not necessarily work out exactly the way that you want, but fail forward. Be able to sort of learn continuously as you try to seek out the things that might be helpful, and get that positive feedback loop going, so that you know whether or not things are working.
Right, and I want to squeeze in one more question. And
Albert, I was ready to respond to that question.
Oh, okay.
Can I real quick?
We want to maximize
because
your time.
Because were flowing out. And I jotted them down because they were just filling out so quickly. I would just start with one. If I were an employer, I would start with promoting the fact that sickness is not the norm. And then from there, I would focus on that ideal of achieving optimal health. That what do we need to do? What does that mean? How do you break that down? And then when I think about my employees in my company, I would think about how I can help them promote balance in their lives. So again, big term, but you break that down in terms of what that really means. And then help to connect the employees to community resources. As Dr. Meyers pointed out earlier, when we think about the contributors and the drivers of healthcare, 80% are the social factors that are outside of the walls of our workplaces. And so that's how if I were an employer, would approach it. Cast that vision, and then start breaking it down in ways that's going to connect with employees.
That's very well said. Appreciate you sharing. Adam, I just want to squeeze you in here. Any thoughts to build on what Bridgette and Amanda shared here before we close out?
No, I think they've covered it very well. It's going to take a lot of different sustained strategies to do this again, but it's important work, and grateful for the opportunity to have the dialogue today. You can feel free to reach out to us again. I saw there were other questions in the chat room, and we can connect with you directly if you'd like on those.
All right, thank you. So unbelievably, we're already closing in on the end of our time today. I want to thank everyone for tuning in to be a part of this discussion. I hope you've gotten as much out of this as I have during our very quick 1 hour. That is, of course, one webinar and more conversations coming in the future, keyed in on the topic of health equity. I want to extend a very special thanks again to my fellow panelists. And for our audience, I hope you'll keep the conversation going with your colleagues, your health plan partners, and others that you work with. And I hope you'll take it from there into implementing solutions that drive change and advance health equity for your workforce. For more information on advancing health equity, remember to check out our latest mini e-magazine and other resources at smarterbetterhealthcare.com. Thank you, everyone, for tuning in today. We wish you and your families a very happy and safe holiday season, and we look forward to connecting with you again in the new year. Take care, and we'll see you again soon.
Thank you.
Be well, everyone.
Bye-bye.
Bye-bye. You too.